Hello everyone, this is Doug Nelson, the president of Bodywork Associates, and in this video I'd like to review TMJ pain and discomfort and how our precision neuromuscular therapy might be a useful avenue for you to pursue if you struggle with TMJ pain. Oftentimes TMJ pain is called TMJD or temporomandibular joint dysfunction. And as you see in this, it's the second most commonly occurring musculoskeletal condition that results in pain and disability, and that's right after low back pain. Wow. I think it's just much more serious than people actually realize. And if you are someone who struggles with this, you probably already know that there are more people out there than you ever realized who really struggle with jaw pain. And the question is, once you have this, what is a reasonable approach to this? And there are many different symptoms of this, as you see in this chart. Some of those symptoms can be headache kinds of things, and the pain in the forehead and the temple, tension type headaches, something that will mimic a migraine or actually accelerate that process, so your migraines are more frequent if you tend to get those. It can be pain behind the eye, of course. Tooth pain is very common. Pain in the ear is true for about 80% of the people who struggle with TMJ pain. And interesting, we'll explore this in a little bit, but also shoulder and neck pain can be a result of a problem with the musculature of the jaw as well. And of course, symptoms that are localized to the jaw are very, very common. So one of the problems with temporomandibular joint pain is that it's influenced by many different things. Stress absolutely affects TMJD, but stress isn't a cause in the sense that people can be under stress and not have that symptom. Does it exacerbate the problem? Absolutely, and the data is really clear about this. The same thing could be true with any one of these things. Posture has an effect on this. So does your occlusion. And if you talk to your dentist about this, they'll try to make sure that the way your teeth meet is the most optimal position. But that alone, any one of these alone is probably going to be a struggle. What you want to do is look at all of these together and see if you can deal with this on multiple levels. And that seems to be the most reasonable strategy. The one strategy that most people overlook is very specific, very precise treatment of the musculature around the joint. And if you look at that musculature, you look at some of these muscles like the temporalis, here's the masseter. These are very, very large muscles, very, very strong muscles. They both have that strength, but also neurologically, they're very, very powerful, and they have an input into the nervous system that is unlike input anywhere else. If you think about getting a paper cut on your finger, not a fun thing. But if you think about getting a paper cut on your tongue, oh, baby, that's a whole different experience, because our nervous system is wired in this area much differently than anywhere else in the body. It's super sensitive, meaning that any pain there, if you've ever had like an infection in your tooth, you know a little bit about this because it will get your attention like nowhere else. And it's just part of the way our nervous system is wired. So when you have a problem in these muscles, it will command your full attention because it hurts like nowhere else in the body. And again, muscles play a large role even in the function of the joint. When you look at the joint itself, it's a very, very complicated motion, this simple thing of opening our jaw, and it happens on both sides of the body simultaneously. Nowhere else is that true, that you have a joint on either side of the body that has to move in perfect harmony with the other. And then to make that happen, you have all these different muscles that have to coordinate that movement together. If any one of them loses their sense of humor and then has a problem, it will set the whole system into disarray. And that's where specific treatment comes in. The other thing that's really interesting is that in one research study, they took people who they knew had a problem in the joint, and the problem was severe arthritis. They anesthetized the joint, and what they assumed, reasonably, is that where you would feel relief is in the joint itself. That's not true. Actually, where people felt relief was in the muscles of the neck and upper shoulder. So here's the really interesting thing. A problem in the jaw can actually make the neck muscles more sensitive. So you can have neck pain never realizing it's really coming from your jaw, not the neck itself. And all the strategies to address the neck pain will ultimately be frustrating because that's not where the source of the problem is. And you may be unaware that the problem's really coming from your neck. That's our job, is to help figure out which direction this is coming from. Is, like, if you have headaches, is it coming from the neck and shoulders upwards to create the headache? Or is it actually really coming from the jaw and the face, which is lighting up the neck and also being responsible for the headache? It's a complicated process. So that's part of really what we do at Bodywork Associates. It's about that really careful, really thoughtful, really thorough approach to treating and addressing muscular issues. And nowhere is that more important than issues of the face and the jaw. And that's why we have so many dentists that refer patients to us for restricted range of motion. Sometimes after extended dental procedures, the muscles can be really, really sore afterwards. Of course they were. You've held them on a stretched position for a long time. There are a host of reasons that you might have this examined, but it shouldn't be overlooked, and I think you'll find it really, really useful. I hope this helped. Thank you so much for watching the video. If you have any questions, please feel free to call our office and talk to one of our therapists who specializes in TMJD treatment. Thank you.